CEO of Georgia Core, and I'm really excited today to be joined by Kelly Wiedower. She is a family nurse practitioner at the Oconee Valley Healthcare, and she's which is a federally qualified health center here in Georgia. And she is a wife and mother of 3 children. And she has battled colon cancer in her life. And this March was Colon Cancer Awareness Month. I wanted to have a conversation with her. So Kelly, welcome. Thank you so much.
Thank you.
Absolutely. Well, if you wouldn't mind telling us a little bit, March is Colon Cancer Awareness Month, and you were diagnosed with colon cancer at a very young age. Can you tell us a little bit about how your cancer was discovered?
It actually will be 20 years this year, and I had my first child in January that year, and I remember saying to my mom and my mother-in-law that when I was pregnant, I was having like stretching pains. I gave them a name because I was having these pains and I'd never had them before. And they were on the side. And I remember them thinking, oh, well, they said to me, it's been a long time since we've been pregnant. I don't remember those pains. And I said, okay. Well, then I gave birth to her in January. And then in March, the pains were kind of lower. And so because at that time I was 25 years old, had no other health history. And so I went back to my OBGYN saying, okay, the only thing that I've done differently is had a baby, and this is lower pelvic pain now, maybe something's wrong there. And so I went to see him, and he immediately did an ultrasound and didn't see anything. He was looking obviously at my uterus and my ovaries more so, and said, go home, call me in a month if you're still having the pain. So I did, and so then he ordered a CT scan. That came back with nothing in the lower pelvic area, but it came back with a spot on my liver. And so ordered an MRI to get a closer look at that. And then based off of that, scheduled me. And so now we're already in August. He scheduled me for a biopsy of the liver and an exploratory exploratory lab to see what might be causing my pain in the other area. And the pathology came back on the table before they could even close me up that it was colon cancer. So they tried to do a colonoscopy on the spot. I was not prepped.
Wow.
And it was so bad that they could not advance the scope. So scheduled me the following Wednesday for a partial colectomy. And my doctor my OB at the time asked me, so he was nice enough to say, call me if you have any questions this week. And this was a Friday at like 6 o'clock that I get these results. And my mom had driven home to Atlanta with my 8-month-old because she was like, I'll take care of her for the weekend. You're going to recuperate, before we even had the results. And so my husband had to call her on her way back to Atlanta and tell her. And
awful call to make.
Yeah. So that weekend, I called my OB and just, was kind of just talking through some things, because my surgeon had said the tumors, there's 2 tumors in my liver, that they were so close to major arteries and blood vessels that he couldn't operate, because he was a general surgeon who had done the biopsy.
Right.
So, not out of the norm. So my OB asked me if I had family in Tampa, New York, or Houston. And I said, I have family in Houston. He said, then if I was you and you were my sister, or you were my sister, I would say go to MD Anderson. Be somewhere where you have family as a support network. So he was obviously offering Sloan Kettering and one in Tampa that I just, Mayo Clinic.
Yeah.
And so that's where I went.
Wow.
So
that's amazing, because that's, as we talk about Georgia Core starting back in 2003, it was right after this, I guess. But so much of what we talk about is that we want people to stay in the state because they need their family. They need their support system to go through a cancer diagnosis and cancer treatment. And that's basically what your doctor was telling you, to find somewhere, because it really wasn't available in Georgia at that time.
Yeah. And I was lucky enough to do a hybrid. So I went out there 2 weeks after, well, less than 2 weeks exactly, to the diagnosis. And so I had surgery out there to remove the tumors in my liver, but I did my protocol back home.
Okay.
So they were really great to work with me and just send the protocol over here to Athens and carry it out here.
Oh, that's so. At least that's better that you
Yeah.
could do that at home.
Yeah.
But, I think it's so amazing that now we have an NCI designated comprehensive cancer center in Emory. We have so many other hospitals that can handle. And here in Athens, UCBC, Piedmont, there's great great people here that can do the work here as well.
Yeah.
So that's fantastic. Well, let me ask you, so how did cancer impact your young family? You had 2 children after having cancer, so how did that impact your family?
It was hard for years because, we were young, we had just been married a couple years, and all of our resources had to be diverted to my cancer treatment. And so any financial plans or anything that you try to make as a young couple, that all goes to the wayside, and everything is about getting to MD Anderson, paying my medical bills, and then all of that. So that was really hard. My mom was great enough to come over, and so my treatment would start on a Monday, and I would sit there for 8 hours getting an infusion, and then I would leave with a little portable pack for 2 days that I would wear at home, and then on Wednesday I had to go back and get detached. And so she would come over and help me Monday to Wednesday, and with my newborn baby,
Right.
and cook us meals so that my husband could go to work, not have to work, so he could pay the bills in that respect.
Absolutely.
So it was very hard for us at first.
I bet.
Yeah.
Well, how has your cancer journey, impacted your children and raising your children as far as what their own health, and then mentally having to think about that there's cancer in their family?
We joke with them that, most kids look forward to turning 16 and they get handed some keys, and I get to hand them the ability to go get a colonoscopy. So our oldest daughter had her first colonoscopy, not something that you usually think about doing.
No.
We did let her go till she was 18 instead of 16, so we were nice in that respect. But so they, and it's interesting because she knows more or heard more of us talk about it when we were younger, and it seemed like for years we accidentally didn't bring it up much, and so a few years ago it was kind of news to my 12-year-old that I had cancer.
Oh, wow.
And it wasn't intentional, but I did, something had come up one day and he was like, wait, you had cancer? So that was a different experience with him,
Yeah.
But they all know now, so that we'll either have to do colonoscopies or go ahead and do genetic testing, blood work or something, just to see who needs to be screened more.
Right.
So
Absolutely. It's wonderful. That's available now, and
Yeah.
they can go do that. So you're a family nurse practitioner.
Yeah.
So how has having cancer impacted how you treat patients?
So I was fortunate, and it all just lined up, to be hired to do wellness visits. So my main job is to do Medicare wellness visits and make sure, and it's not just Medicare, it's really anybody, make sure that they are getting the preventative services that are allowed to them through insurance and other means. And then FQHC means that we see anybody with insurance, without insurance.
Right.
And so that is my job, which I still love to do. I am able to educate them as to why it's so important with a personal experience. I can sympathize. At the same time, I can also kind of give them a little kick in the butt, because I get to have another colonoscopy this year too. So, and this will be like my 10th, who knows? I don't know how many it is.
Exactly.
So they get a little sympathy from me, but they also get like, it's time to go. You can do it,
Yeah.
So, and I'm not saying that as someone who hasn't experienced it. So I do feel like that's helped with that.
Yeah, I bet. Well, what message would you have anyone out there who is putting off their colonoscopy, or who has not done really what they need to do? Now the age has been lowered to 45 to 75, and some people I know and my friends had put that off. So what would you tell people as far as getting their colonoscopy?
It is so much easier to find it as a polyp and get that removed than to go through what I went through and find it as a stage 4 cancer. I did not realize this for several years because I did not there was a part of me that needed to separate from my cancer diagnosis so I could just be thoughtful in getting well and staying well. So I had a 7 to 8% chance of living 5 years. It's much easier and much cheaper to get a colonoscopy and just have it, if there are polyps, have it removed right then, or get the screening done and go back from 5 to 10 years based on their family history.
Absolutely. Well, we are happy you have such an incredible, positive story that you are here and have lived a wonderful, full life with your family and in your career. So thank you so much for joining us. I really appreciate it.
Thank you. I appreciate this.
Absolutely.